Hello, nursing students. Today in nurses courses, we are mastering diuretics. We'll break down loops, thiazide diuretics, potassium-sparing, and osmotic diuretics, concepts essential for your practice and the nursing exams. Diuretics are powerful tools, but they require careful monitoring of vital signs and accurate medication administration to ensure patient safety. As nurses, we must vigilantly monitor fluid intake and output, blood pressure, daily weights, as well as electrolyte lab results like potassium and sodium. First up, loop diuretics. These are the most potent, working in the thick ascending limb of the loop of Henle. Common example is furosemide. Watch out for adverse effects like ototoxicity, severe hypokalemia, and hypotension due to rapid fluid loss. Before giving a loop diuretic, always check potassium levels. Afterward, monitor daily weights and teach patients to change positions slowly to avoid dizziness. Here's a nursing test question. A patient on furosemide reports ringing in the ears. What is the nurse's priority action? Take a second to think. The answer is stop the infusion and notify the provider. Ringing or tinnitus indicates ototoxicity, which can be permanent if the medication isn't stopped. Next, let's look at thiazide diuretics, like hydrochlorothiazide. These work in the distal convoluted tubule and are often first line for hypertension. Common side effects include hypokalemia, but also keep an eye on blood sugar and uric acid levels, as thiazide diuretics can cause hyperglycemia and gout flares. Tell patients to take diuretics in the morning to avoid nocturia, use sunscreen due to photosensitivity, and monitor glucose in diabetic patients. Third, we have potassium-sparing diuretics, like spironolactone. These work by blocking aldosterone in the collecting duct. The biggest risk here is hyperkalemia. Unlike the others, these keep potassium in the body, which can lead to dangerous cardiac arrhythmias. Nurses should advise patients to avoid salt substitutes, which often contain potassium, and monitor for endocrine effects like gynecomastia. Exam question time. A patient on spironolactone has a potassium level of 5.8 milliequivalents per liter. What is the nurse's first action? Should the nurse administer the medication as ordered? Should the blood test be repeated? Maybe the dose need to be held and the provider notified? Or should the nurse encourage the patient to consume potassium-rich diet? Potassium is high. The nurse must hold the dose and notify the provider. An EKG is also a priority to check for peaked T waves or other signs of hyperkalemia. Finally, we have osmotic diuretics, primarily mannitol. These pull water into the renal tubule via osmotic pressure. Mannitol is often used to reduce intracranial pressure or intraocular pressure. However, it can cause sudden pulmonary edema as fluid shifts. Critical nursing step. Mannitol can crystallize at room temperature. Always use a filter needle and an inline filter when administering it. Last practice test question. Before administering mannitol, the nurse notices crystals in the vial. What is the nurse's action? Think about patient safety. The nurse should warm the vial to dissolve the crystals and then allow it to cool to body temperature before giving it. Never give a vial with visible crystals. Before we finish, remember this. Diuretics are medications that help the kidneys remove excess fluid and sodium from the body. They are commonly used to treat heart failure, hypertension, pulmonary edema, kidney disease, liver disease, and conditions involving fluid overload. The most important adverse effects to remember are dehydration, hypotension and orthostatic hypotension, electrolyte imbalances, hypokalemia with thiazide and loop diuretics, and hyperkalemia with potassium-sparing diuretics, and ototoxicity with rapid IV administration of loops. As a nurse, always monitor daily weights, blood pressure, intake and output, electrolyte levels, especially potassium, signs of dehydration such as dry mouth, dizziness, and decreased urine output, patient safety, especially fall risk related to dizziness and orthostatic hypotension. Thanks for watching. and I'll see you in the next Nurses Courses video of Getting It Right Every Time.